Of my presentation is Trust Me, I'm a Vapor. Hopefully you get the sentiment of what we're trying to convey in this presentation about Vapers' views on partnership working between health professionals and the vaping community to support smoking abstinence. It's part of a wider programme of longitudinal research called E-Cigarette Trajectories, which is headed by Dr. Caitlin Notley, and Sarah Gentry is also presenting some data later in this session. I'm not a vapor, by the way. I am a doctor, although not a proper medical one, but hopefully you'll hear some you will hear some vapors' voices in this presentation. So that's my conflicts of interest statement. The presentation will take a standard introduction, methods, results, discussion format. So in the UK, we have a contradictory policy and practice context. On the one hand, public health policy states that people who want to use e-cigarettes should be supported to do so. On the other hand, although it's improving, many health professionals don't feel able or don't feel they have the knowledge to support people using e-cigarettes. And this is situated in a social policy and social context which perceives vaping to be as harmful as smoking. We know that most quit attempts are not aided by health professionals, and for those quitting using e-cigarettes, the vape shop is the front line of support. And research we published last year shows what every vapor in this room already knows, that reputable shops support people in various ways as outlined in our thematic model, but basically helping people to get an affordable setup which works uniquely for them and their requirements in terms of nicotine, delivery, etc. We concluded in that paper that because of the excellent work shops do, that some partnerships between healthcare professionals and the vaping industry might help some people, especially those who are maybe a bit intimidated by vaping or maybe from harder to reach groups. So what are the possible approaches? So in the UK, we had the recommendation last year that e-cigarettes could become available on prescription. Peer support, peer support has also been suggested, and we know, of course, that this already happens informally amongst the vaping community. And there are some existing partnerships which have emerged over the last few years. I'm aware that some of these ideas might be quite new to you if you're not from the UK. I'll briefly go over them now, but I'm happy to answer any questions at the end, and I'm sure there are people in the audience who have direct experience of these approaches as well. So we have informal referrals, and this is simply a doctor recommending to a patient to visit their local vape shop to get advice on e-cigarettes, or maybe having a list of recommended retailers. Written information is displayed in shops or given out. So I know of shops who have Cancer Research UK posters on their walls. We also have our Staying Switched leaflet that we've produced, which some vape shops are giving out to their customers. We have voucher schemes, and this is where a stop smoking service will deliver their usual service to clients, but also give their client a e-cigarette voucher to spend in a local vape shop. Outreach, where the vape shop has met or held sessions for healthcare professionals, like the example in this quote. There's also smoking cessation training for vape shops, and this could be a health professional such as a stop smoking service advisor or a pharmacist delivering the training, or it could be online. So for example, I know of one leading UK vape retailer who encourages all their staff to complete basic, freely available online smoking cessation training. Then we have something I've called pay per quit. This is where vape shops are trained to by the local stop smoking service to advisor level. The shop then recruit and deliver support to their smoking customers, who the shop registers with the local stop smoking service. But all of the support is delivered by the shop staff in the shop. So the customer or the client doesn't have to go to see a stop smoking service advisor. The local authority then pays the vape shop if they have a verified quit at 4 weeks, and that statistic goes towards the local authority statistics on quitting smoking. Finally, there is training for pharmacists by vaping industry to deliver support on their products. So voucher schemes, pay per quit and pharmacist training have been associated with high quit rates, although as far as I'm aware there haven't been any formal published evaluations to date, and there have certainly been no trials on any of these approaches. So in the research I'm presenting today, we wanted to know how helpful vapers think these types of approaches are. So this is the design of the wider e-cigarette trajectory study on the left. The data I'm drawing on today is from the follow-up interviews and follow-up survey with people who quit smoking or tried to quit smoking using an e-cigarette. And we asked both groups to rate on a 5-point Likert scale how helpful they found the approach or would have found the approach to help them stay stopped from smoking. And we also asked them open-ended qualitative questions about these types of approaches and also medicalisation more generally, which we analysed thematically. Just briefly, this is the sample of the two data sources. Unsurprisingly, as a result of recruiting mainly via social media, the survey did have more representation from men who were vaping only and who were really invested vapers and considered vaping to be a hobby. The interview sample was more diverse, relating to gender, vaping status and vaping identity. Okay, so I'm going to present the Vapers ratings first. We gave them a list of 14. So just for the sake of time, I'm presenting a subsample of those list of 14. The vast majority of participants, though, would have found all of the approaches we listed helpful on some level. But these findings were typical in that larger proportions of participants rated more complementary approaches, such as referrals or voucher schemes, as being very or extremely helpful, compared to more medicalised approaches, such as prescription or formal smoking cessation training support in shops. And interestingly, there were no significant associations between the ratings of approaches and whether or not the participant was male or female or their vaping identity. So moving on to the thematic analysis of the open-ended questions, there were 3 theme groups which I will describe in turn. The first included themes relating to or pro-partnership themes. So there were comments that these types of working with health professionals could offer much needed reassurance about health risks, safety issues and quality of advice, that these approaches could simplify vaping and make it less intimidating for smokers, which we know can be a barrier. That they could overcome the initial cost for people, which can be an issue for low-income or vulnerable groups. And some people compared it to NRT and felt it should just be treated exactly like NRT. We even had one person who compared it to NHS glasses and said, well, you can get your standard NHS pair or you can splash out on a really funky pair of designer glasses. Prevention is cheaper than cure, and therefore it is a good use of NHS money, very much a harm reduction viewpoint that really came over in the Vapers comments. There were concerns about the commerciality of shops, and some vapers felt that there would need to be a system, such as a kite mark, to ensure the quality and consistency of the shops taking part. Okay, so I've got some quotes here from our vapers. Let you skim read over them. These will be going online, so if you don't get a chance to digest all of it, then please look online. Okay, I'm going to move on now to the second theme group. And these were themes which were kind of anti-partnership and intervention. So these included believing that people should be responsible for their own health, that vaping is a personal choice, that it's unethical to fund something that normalises nicotine, continuous addiction is not proven safe, arguments we would have heard from elsewhere, but quite interesting that some vapers were actually saying this. View that the NHS was already underfunded and don't want to burden it anymore. That they could be open to fraud and abuse. And again, concerns around the commerciality of shops, but this time not believing the shop advice could be relied upon because their priority is business rather than support. Again, here's a few quotes on those themes. So the final theme group were laissez-faire themes, and this is very much an if it ain't broke, don't fix it viewpoint. People saying that vaping is already affordable and effective and the shops are already doing an amazing job to support people to quit, so we don't really need these kind of interventions. That smoking is not an illness and e-cigarettes are not smoking cessation devices. A belief that working with healthcare professionals could lead to regulation, which would then limit vaping choice, price and pleasure, and really just take the fun out of vaping. and that any regulation could impact on small independent businesses and the industry would become monopolised by big tobacco and big pharma. And there were some comments that it was just unfair to expect shop staff to deliver this sort of intervention, that it wasn't their job role, they were being paid a retail salary, and it just wasn't fair on them. And instead, people favoured knowledge transfer and dialogue between healthcare professionals and the vaping community. I'm sure you're all familiar with these arguments already. Again, some quotes from our vapers. Okay, so to wrap up, most vapers we gathered data from would have found some partnership working helpful when they first attempted to quit smoking. E-cigarettes being available on prescription might help some quitters, but that vaping-specific support and product choice are perceived as crucial for others. And very much that vapers face the same dilemmas that all of us in this room face. You know, can there or should there be policy to please everybody? Are we all working towards the same goals? How do we balance out the commercial and public health interests of vaping? So the next steps for the e-cigarette trajectory study is to explore the views of health professionals, industry and smokers on this partnership working. And we're also developing an intervention which we will be applying for funding to trial and hopefully get funding to start next year. So just quickly before I finish, I think sometimes we're at risk of overcomplicating things. And I think sometimes the simplest ideas are the best ones, like this health warning label, which one of our research participants came up with. I'm sure he's not the only person to have thought of it. But I think I've probably run out of time, so I'm just going to leave that there for you all to have a think about, for you all to ponder over. Please visit our website for links to our publications. We also have a Staying Switched leaflet that we've produced. I've got some copies, not here, but I've brought some to the conference, so please come and find me and I can give you some. And also links to our industry and health professional surveys. Thanks very much.